At Salt Lake Behavioral Health, we use the Courage to Change addiction medicine curriculum, which speaks both to trauma and substance dependence. We've found that it is impossible to treat substance dependence without looking at the reasons why somebody's using, and usually that reason is trauma. 87 to 90% of all patients who struggle with substance dependence have histories of trauma. So the goal in our processing and psychotherapy groups is to get the patients to start talking about the early childhood or later in life trauma experiences that have led to their wanting to use, and getting them to learn to cope with the trauma in ways that don't involve using. Our Courage to Change Addiction Medicine workbook is fabulous because it has 25 different modules that dig into ways to cope in life with trauma without having to use substances. When a patient is able to make the connection between the trauma that they experience and the fact that they use, it's like this door opens, it's like a light bulb comes on, and all of a sudden they are making sense of their lives for the first time. It's really kind of exciting to watch patients as they come into the program and start understanding why they use. Once they understand that trauma is at the bottom or at the root cause of why they're using, it's like the door opens and they feel free for the first time. They're able to understand that they're not bad people, but bad things have happened to them. They aren't hopeless. There's hope, because once they get to the root cause of why they're using, then they're able to start understanding how not to use and developing coping skills that make them move forward in adaptive ways.